Welcome back, everyone. As mentioned, we're going to be talking about Medicare physician reimbursement. Let's take a look. Again, in this chapter, we're going to be looking at Medicare physician and other health professional payment systems. This is a little bit similar to HIM 160, where we have a fee schedule and some other things, but there's some new elements. And some of this is the resource-based relative value scale, the Medicare physician fee schedule. And then we're going to be looking at how these things are adjusted using the geographic practice cost index. Then finally, we'll look at different provisions of the Medicare physician payment system, and we'll talk about the quality payment programs that are becoming more and more involved and more common in terms of reimbursement with Medicare patients. And again, these include, what do these things include? These include office visits, labs, procedures, different types of therapies. These could be done in the physician office, the medical office, if you will. This could be done in a surgery center, procedure suite. This could be done either in the hospital, hospital inpatient, hospital outpatient, things done in a SNF, right? Skilled nursing facilities that we covered a few weeks back. And when we use the term physician, there are more than physicians who can just get reimbursed by Medicare. This also includes such things as chiropractors, nutritionists, physician assistants, nurse practitioners, anything that's considered an in-scope provider. And there's two parts to this. The first part is the resource-based relative value scale. And this is basically giving a value to different types of services. Some services require more technical expertise, more skill, more time consuming, different levels of training, all these different types of things. And it's basically a way of putting a value on each of these, right? Kind of like a weight, if you will. Then the other part of it is we have the Medicare physician fee schedule. This is like any other fee schedule. We have a HCPCS code and we have a reimbursement amount. And this is the maximum amount that Medicare is going to pay for a service. And this is determined by multiplying the RVU, the relative value unit, if you will, by the conversion factor. That kind of leads to the next question. What is a conversion factor? It's basically an across the board multiplier that we use to adjust and set a rate, in this case, a reimbursement rate. So you can think of these payments to providers on three components. The first is a relative value unit, and this is something that's attached to a HCPCS code. It's a measure of resource utilization, not just the physician component, but supplies, what have you. And these are further split into different categories. Next, we have the geographic practice index, and this is an adjustment for the geographical differences in cost. Things cost more in California, say, than in rural Alabama, so it's a way of adjusting this. And each RVU category has a corresponding geographic practice index. Here in Oregon, there are two of them, one for the greater metropolitan area of Portland and one for the rest of Oregon, right? And then finally, we have the conversion factor, which we already talked about. This is a national dollar multiplier that sets the reimbursement rate. So what goes into an RVU? Well, basically, we are looking at the type of mental effort and judgment, technical skill, physical effort, psychological stress, time and intensity, all these other things. And then we have, within that, we have the practice expense. So this is not only the nurses, the nurse practitioner, the medical assistant, what have you, but it's also the administrative staff. It's the front office people. It's the people that answer the phone, what have you. And Table 8.1 in the text gives you some great examples of that. And then finally, we have the malpractice premiums. And CMS is great at collecting data on what practices are paying in terms of malpractice premiums, and they give an adjustment for that. We talked a little bit about the Geographic Practice Cost Index, and this is based on the locality. It's relatively easy to look these up on the CMS website. And this covers everywhere in the United States, right? It can be a large metropolitan area like San Francisco, Los Angeles, Boston, as it says here, or it could be a rest of the state area, such as in Oregon. In Oregon, we have the Portland area and everybody else, right? And even smaller states have an entire state will do that. And there's one Geographic Practice Cost Index for each RVU category. And these conversion factors, the CF, if you will, are set and adjusted at the start of each rate year. And this is the Medicare's way of having direct control over all these costs. And like we talked about earlier in the course, anytime there's an adjustment to anything going on in CMS and reimbursement, it's covered in the Federal Register. And your book gives you the example of this, the RVU work, the GPCI worked, plus the RVU for the practice element, the GPCI practice element, and so on. The malpractice premium for the RVU and the GPCI, the conversion factor, and then that determines the physician fee schedule amount. And again, a lot of third-party payers utilize the resource-based relative value scale for reimbursement. They modify their own needs by modifying the conversion factor, right? So CMS frequently does things, comes out with these formulas, and payers adopt the concepts and adjust them to their own needs. And again, these are noted in your book as well, figure 8.1. Right, so this is based on CPT code 99202. The locality is Ohio. So this is the work. The relative value unit is 9.93. The Geographic Practice Index, the GPCI, is 1, right? So we have 0.93, right? Same thing for the PE. Add these up, and so on. Over here in 8.2, we calculate the non-facility payment. So in this, we have work value of 0.90 for an RVU. We have the GPCI at 0.990. So we wind up with 0.891. Then we take the practice expense, the PE has an RVU of 1.15, a GPCI of 0.915, put together 1.05225. Going down to the next line here with the malpractice, we have 0.10, the GPCI of 1.005, right? So we wind up with 0.1005. Add these all together, we wind up with 2.0438, the conversion factor, right? of $36. And so we wind up with an adjusted payment of 73.58. And if you're interested, you can look at the Medicare physician fee schedule search by clicking on this here and bringing these things up as demonstrated in this slide here. As we've talked about before, Medicare makes adjustments here, like for instance, the bilateral multiple procedures, physicians assisting on surgery such as cardiac surgery, which usually requires more than one surgeon. There are different adjustments that they make, and these are all explicitly spelled out depending on the procedure. These are just global examples here on the slide. And like with hospitals, they have other adjustments that the federal government likes to do, such as for underserved area adjustments, health professional shortage areas, and so on. So providers that qualify by working in these areas get increased reimbursement. To help you understand these things better, I'd like to ask you on your own to do these and just run through the math on these to make sure that this makes sense. In this case, Dr. Johannesson is performing an esophagescopy, and during the procedure, she removed 2 polyps using a snare technique. He reported HCPCS code 43217 for the procedure, and she performed it at a facility-based surgery center in Ohio and as a Medicare PAR provider. I'll let you do those on your own. And that's all I have for you. We'll see you online. Please stop by office hours if you have any questions about any of this material. We'll see you online. Bye now.